All right, so we're sitting here with Jeannie. Jeannie, could you tell me what brought you into the office, please?
I had scoliosis most of my life, but it never really interfered. I led a very active lifestyle, dancing, running, biking, until I hit 40, and then it started to deteriorate, and I had back problems that would lay me up at least once or twice a year. By the time I finally considered the surgery for it, my left hip was hitting my left rib cage when I was driving the car. So I went to one of who's considered the top doctors in Philadelphia, and I had rods and screws placed in my spine and was told I would return to work probably in 4 months. This never happened because I was in more pain after the surgery than I was prior to having the surgery, and the pain continued for 2 years. I tried just about everything except chiropractic on the advice of the surgeon. I had acupuncture, I had constant physical therapy, and exercising, doing everything that I could, and nothing relieved the pain. So it was decided by the neurologist and the surgeon that the rod removal would be the best thing for me. So they took out the rods and screws and assured me that the fusion that they had done would hold my spine steady. This also was not the case. Almost immediately my spine began to curve more and more, and I was in just as much pain as I was when I had the rods. Lenny's mom is my best friend, Alice, and she had mentioned that I should try coming in to see Lenny and see if he could do anything, which I resisted doing because of this advice from the surgeon. Ironically, 3 years later, when I was still in pain, I told the surgeon that I did, in fact, come to the chiropractor, and he said, good, good, good. Surgeons actually don't want anything to do with you unless they can operate on you, is my opinion. And anyway, since coming here, I've found that Dr. Lenny, if you tell him you have a problem, he goes immediately to the source of that problem, just by you pointing it out. He's also put me in this position called mirroring, where he lays me opposite of my curve. And I wouldn't have believed it, but I saw on x-ray, looking at early x-rays and then new x-rays, that my spine had, in fact, moved a little bit, which they told me was never possible. So I'm just very thankful. I finally found somebody that I think not only cares about his patients, but truly cares enough that he wants to help everybody, and it gives you a good feeling to know that you have somebody that you can come to if you were to have an emergency. Before that, I had no one. Even my physical therapist, who I love dearly, I couldn't call her in an emergency and say, I can't move my arm, which you can do with Lynn. Also, the office atmosphere is so comfortable and caring. Everybody is very knowledgeable, very helpful, and very happy. There's even a joke or two once in a while. So in fact, what happens is you leave here not only feeling physically better, but I find mentally better too. So I just am thankful that I found a person who actually cares about my health and well-being.
Thank you very much. Would you mind just telling us just a little bit about the types of stuff that you can do now that you weren't able to do in your quality of life?
I can walk further. I can ride my bike. That was out of the question before. I can kayak a little bit. I kayak much more than that before, but I could kayak a little bit. And I can dance, which is really important to me. But I pay the price, but still, I can dance and know that Lenny will fix it if I do anything terrible. I'm just a happier person because it's expanded the little bit of life quality that I had, it's been greatly expanded since coming to Robert's Family Chiropractic.
Thank you very much, Jean.
Thank you, Len.